Hey all, welcome to my Kitchen Table Memory Minute. Today we're going to talk about the Alzheimer's Association Clinical Practice Guidelines focused on validated clinical instruments. This was just published and accepted as of September of 2024. We're focused today on developing a patient operating system that is decision navigation support on the earliest possible detection of cognitive changes that might lead to Alzheimer's disease. But what's the most fascinating is understanding that some impairment is reversible, and especially if it's attached to conditions that have a symptom overlap. That makes it hard to differentiate between some underlying conditions versus Alzheimer's. So this is good news. It means that if you get a diagnostic workup with your physician, you can figure out what's going on wrong and actually potentially improve your cognitive function. And you might also learn that you do not have Alzheimer's disease, which is a huge relief, or your risk is low. Now, 3 quick points that we picked up from the practice guidelines, and they really sort of verge on the paradox of the condition. One paradox is that early testing guidelines do not consider individuals who do not have symptoms. The guidelines are focused on helping physicians with patients who do show up with clear memory, thinking, or behavioral challenges. Then the doctor will take the appropriate steps of diagnostic testing. But keep in mind, our whole focus and worry is that people are showing up too late. So if they come in with early, mid, or late stage dementia, they might have missed the window to take action. So again, we're focused on what is as early as possible detection, that early detection period, and what tests are actually validated so that these changes that are very subtle can be detected. Now let's go into the second one. It's important to establish a current baseline in order to track changes. EMRs are helpful, and traditional pen and paper tests and clock drawings can also be documented in the EMR. But is that really being used to track changes effectively? Obviously, we're thinking about the power of a digital capability or digital test that can capture your memory score, compare it to a normative database of your peer group, and then when you take the test annually or whenever needed, you can see how you're changing in comparison to a validated data set. That's the source of accuracy for tests like the MCI screen. So we do need a digital cognitive test that can solve for really accurate longitudinal tracking. Number 3, the third paradox in cognitive testing is we want to establish a proactive behavior in individuals who are focused on their performance before their memory and thinking worsens. To the degree where they can detect it for themselves. That's the problem. Often people that show up at late stage can't detect it for themselves, and they really are relying on a caregiver or family member who knows the patient. Because cognitive impairment creates a loss of awareness and insight that only a family member or friend can detect. So there's a lot of the reason that individuals can go a long time before a condition is picked up, especially if they're going to their doctor visits by themselves. Again, another paradox in a very challenging category where we're emphasizing for performance-minded individuals or those with a family history who really do want to be proactive and add cognitive testing into their annual workup, either on their own or in their physician's office, right? So there's a lot to digest for this one readout. There's a lot more in the guidelines that are really important. Please check back with us and we'll go deeper next time into tracking the history of cognitive symptoms and how mood and behavior can be detected to provide clues that a physician's workup may be warranted to look for underlying conditions that can either help or prevent or delay the onset of cognitive impairment, whether it's Alzheimer's disease or not. Appreciate your time, and please share or like this video and register for our newsletter in the bio. Thanks so much.